Hi, my name is Alyssa Nelson with Nominastra Physical Therapy, and today I'm going to discuss areas of the body that are more prone to be affected by osteoporosis or osteopenia, and kind of what are some activities that we tend to see those areas and when you should maybe consult a physician if you are having some issues. So osteoporosis and osteopenia tend to affect three areas of the body more than others, the first one being the thoracic spine. So especially up from that neck down to about mid-back level. This is where we will see a lot of compression fractures. So if you've ever seen anybody that is super rounded or hunched, they might have some compression fractures on the front of those vertebrae. You may also have, if you or anybody that you know used to be quite a bit taller, say you were 6 foot previously and now you are 5'10", 5'8", any of those things, it may be an area to look at, and you're also having some back pain, might be an area to look at if you do have some thoracic fractures there. They're vertebral fractures. The next area that we tend to see a lot of these are the hips. The hips tend to be a very dramatic area, and that the outcomes for them can be a little more intense, a lot longer recovery, and can tend to cause a lot more comorbidities and problems following. So a lot of times we see hips with falls or anything like that where we tend to fall onto that side. You'll see them up at the femoral neck, which is right kind of before where the hip goes into our actual joint. Another common place that's very common for that. The third option is wrists. So we tend to see this a lot with falls. So whether it be, falling, trying to catch yourself, falling into a wall, anything of that sort, the wrist tends to take a lot of the brunt of those activities. Another honorable mention for areas, we do also see a lot of humeral fractures. So the upper arm bone, you'll see this a lot again with people that may stumble into a wall, catch themselves with their arm, or fall onto the elbow. We can see humeral fractures as well as an area that this occurs. These fractures can often occur with activities that wouldn't necessarily make you think that you would break a bone. So if you're living kind of normal life, you trip, you stumble, fall into a wall and break your wrist or your shoulder, this might be an area that you might want to consult with your doctor, as that is not usually a normal reaction to a short fall into a wall or anything like that. With the thoracic spine, some activities that can cause fractures, surprisingly, is coughing and sneezing. So this is an area we see people, they're like, man, I just had a big sneeze, or I had a coughing fit, and I have had back pain that has stemmed from that and won't go away. That is also an area might be worth getting checked out. If you know you have osteoporosis or osteopenia or have any of the risk factors, may be a good option to discuss with your doctor and get that checked out. As always, if there's any questions, feel free to reach out to us at the clinic or check us out at knobpt.com.